Welcome to the Center for Health Affairs Board Education presentation, The Focus on Quality, a closer look at a national trend. This presentation is based upon the Center for Health Affairs issue brief by the same title, which can be found on CHA's website, www.chanet.org. All issue briefs, as well as their corresponding PowerPoint presentations, are available on our website in the Publications section. This issue brief, originally released in April of 2006, examines recent quality initiatives in the healthcare field. Quality improvement has long been a part of day-to-day operations in a hospital and is a cornerstone of every hospital's mission. In recent years, the call for quality has grown even more insistent as insurers become more involved in healthcare decisions through the rise of managed care. Other interested parties, such as employers who pay for health benefits, have taken a keener interest in rising health expenditures and wonder how they might be linked to quality. As a result, the concept of healthcare quality assessment and improvement has begun to garner increased public attention. Hospitals, long familiar with the concept of quality improvement, strive to provide quality care to each and every patient. In 1999, the Institute of Medicine released its now famous report entitled "To Err is Human," which attempted to quantify the incidence of errors in hospitals. This report heightened public discussion on quality and led to a new approach to healthcare quality initiatives, with an emphasis on the measurement of treatment outcomes and the collection of data. It also led to the development and implementation of clinical pathways, which are proven care regimens for particular illnesses or conditions. Accrediting bodies have begun to get involved in the quality movement. The Joint Commission on Accreditation of Healthcare Organizations, also known as the Joint Commission, or JCO, evaluates the quality and safety of care for more than 15,000 healthcare organizations. Healthcare providers maintain and earn accreditation based on how well they meet Joint Commission standards. In addition to undergoing an on-site assessment by JCO every 3 years, hospitals must submit data on several core measure sets to maintain accreditation. These measures rate hospital performance on heart attack, heart failure, pneumonia, surgical infection prevention, and pregnancy-related conditions. The Joint Commission also annually sets national patient safety goals, with which accredited hospitals are expected to comply. The quality movement also involves payers. The administrator of the two largest government-sponsored healthcare programs, the Centers for Medicare and Medicaid Services, or CMS, is involved in several different quality initiatives, many of which link quality and reimbursement. As part of the Medicare Prescription Drug Improvement and Modernization Act of 2003, an initiative called Reporting Hospital Quality Data for Annual Payment Update was created. This initiative stipulated that hospitals not submitting performance data for the 10 starter set measures, such as prescribing aspirin and beta blockers to heart attack patients at arrival and discharge, receive a 0.4 percentage point reduction in their annual Medicare payment update for fiscal years 2005, 2006, and 2007. A 2 percentage point reduction took effect in 2008. The Hospital Quality Alliance is another CMS initiative which aims to publish online information about 22 measures of hospital standards of care for heart attack, heart failure, pneumonia, and surgical infection prevention. Premier Demonstration is a Medicare pay-for-performance project in which 260 hospitals provide data on a set of 34 quality measures related to 5 clinical conditions. Hospitals performing in the top 10% for a given diagnosis receive a 2% Medicare bonus payment for the measured condition, and those in the next highest 10% receive a 1% payment. Hospitals not achieving absolute improvements above the demonstration baseline are subject to reductions in payments in the 3rd year of the demonstration. Business groups have also been heavily involved in pushing quality initiatives. The Leapfrog Group, a coalition of 170 major employers that includes AT&T, Delta Airlines, and General Electric, has a survey tool designed to measure hospital quality and patient safety efforts. Hospitals may voluntarily submit data for their survey. The Institute for Healthcare Improvement, another business group concerned with hospital quality, created the 100,000 Lives campaign, which was launched at the end of 2004. This initiative aimed to get hospitals to commit to adopting 6 steps to improve patient care and prevent avoidable deaths, with the goal of saving 100,000 lives in 18 months. IHI reported that over the course of the initiative, approximately 122,000 lives were saved, prompting the organization to set an even more ambitious goal, saving 5 million lives between December 2006 and December 2008. Efforts to assess hospital quality have also taken the form of rating systems or report cards designed to better inform the healthcare consumer. For instance, most consumers are aware of the hospital ratings published by U.S. News & World Report. In this publication, hospitals are ranked based on 17 specialties, such as cancer care or pediatrics, rather than on procedures. Another company, Solution, annually publishes lists of the top 100 hospitals in the nation. Their ratings are based on 3 main components of hospital performance: clinical excellence, operating efficiency and financial health, and responsiveness to the community. Healthgrades is yet another organization concerned with hospital quality. Healthgrades evaluates the quality of care provided to hospital patients for common medical conditions like pancreatitis and hip fracture. Overall service ratings are based on a 5-star rating system, and adjustments are made to account for the severity of patients seen by hospitals. While quality improvement in our nation's healthcare institutions is certainly a laudable and worthwhile endeavor, it is important to consider a number of factors when looking at quality comparisons. Different hospitals treat different types of patients. For example, a large urban medical center may treat patients who are sicker and have more complex illnesses than patients treated at smaller hospitals, and thus may have higher mortality rates. Therefore, when evaluating quality initiatives, it is important to note whether or not they employ any type of risk adjustment to identify and adjust for variation in patient outcomes stemming from differences in patient characteristics. Also important to consider is the actual measures used in analysis. An initiative that reports on reputation may have different results than one that reports on compliance with clinical pathways. Knowing what it is that an analysis is truly considering is fundamental to evaluating any given hospital's performance on its measures. The increased attention to quality assessment and improvement is not expected to abate anytime soon. The consumer-driven healthcare trend, through the use of health savings accounts paired with high-deductible health plans and other means, is increasingly transferring financial responsibility for care to patients. This is likely to have the same effect on healthcare as on other types of services. Consumers will want to know more about what their dollar is buying them, and some will be willing to pay more for higher quality. In the end, local quality initiatives and those that take shape at the national level are all important components of an overall strategy to reduce the frequency of medical errors, improve the level of patient care, and ensure that performance data is more transparent. This concludes the Center for Health Affairs presentation of The Focus on Quality. We hope you find this information useful. Thank you.